Thank you, sir. I'd like to ask questions both for myself and some of the other reporters who are in the room social distancing. First of all, and this is for yourself and Dr. Birx, what percentage of the population do we suspect to be asymptomatic at this point? Is there a way to figure that out? Seems like the antibody test might be able to assist in determining that number.
Yeah, thank you. So while we're working diligently in the midst of the crisis to make sure that the healthcare workers and everyone who is sick gets provided for, at the same time we're working on tests and assays that will be critical for surveillance. And at the same time working on plans for what we need to do as this moves through the population and we get on the downside, which we're not there yet. And hopefully most of the states will say, like California and Washington, and then what we need to do to be prepared for fall. So all three of those things are happening simultaneously, and there's people working on each one of those work streams. The antibody piece is critical, as you described, because at this time, we can't, if we have, let's say symptomatic status is inversely related to age. And so the younger you are, the more likely you are to be asymptomatic. We have to know that because we have to know how many people have actually become infected. So when we talked about 5 days ago, I think on Monday, I called on universities to work on an ELISA-based test to test for their health workers and really get through that. At the same time, the private sector is working on tests. And what do we want those tests to be? We want those tests to be like what we use for HIV and malaria. Finger prick onto a cassette, you get a line if you're positive, and you get a control line. Negative, the line isn't there, and there's the control line. That's our dream assay because it's a finger prick. In the meantime, we're not waiting. I mean, we're pushing for that. At the same time, we're asking to develop an assay, the ELISA-based assay, which requires a tube of blood. And that's why we're also talking about, could we use dried blood spots? We also put out a call directly out to the military because of the Roosevelt to really test all of the sailors on the Roosevelt with an antibody test to get to this critical issue of asymptomatic and already pre-existing antibody. That would be if the first responders knew they already had it and they had protective antibody, if the nurses knew, the doctors knew, if your school teacher knew, then it's a very different dialogue. So we understand the importance of that, and we understand how important it is in relationship to understanding this epidemic. One other comment, because I know we're always saying who knew what when. I just want to make clear, there's 150 plus countries working on this collectively together. It's devastating for every single country. When we get through this, we can go back and look at what happened, where, and what does this epidemic look like. And when you get through it, then you can validate every model there is known to man. When you're in the middle of it, you have to concentrate on serving the needs of each American and what that need looks like. At the same time, you have these other work streams on surveillance and how to be prepared both scientifically and therapeutically and vaccine-wise for the next fall if that happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community? I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban. You know, it wasn't until January 14th that we knew that there was human-to-human transmission.
Dr. Birx, the president was saying this was going to go away. It's April.
It is going to go away.
This president, you said it was going to go away in April. You said when it warmed up in April.
I said it's going away, and it is going away. Okay.
But
Okay, that was a good answer to your question. No more. That was a long but a very good answer. That was enough for you.